Good afternoon, everybody. I'm really excited that this is 6 weeks long. Um, we're going to see how today goes, and then, based on feedback or things that people are coming for, we can, add conditions and different acupressure protocols as we go along. My name is Jackie LaCava. I have been an acupuncturist since 2011. And acupressure is one of those things. Let's see if I can move this over. There we go. That, we keep in our toolbox. We don't use that often, but I find it's really helpful. Just like when you see a physical therapist and you get homework from them, I find that acupressure is a really good daily reminder to ground yourself and treat really common conditions that crop up during oncology treatment. Um, Two questions I want to answer first. So, how do I integrate these acupressure protocols into current care plans? I would say pick a thing to focus on. The protocol that I'm running through today is my tried and true homework that I give every patient that's looking for something to do on a daily basis because it covers so many different things that come up. Um, so it's a good one to start with. Pick a time of the day that you can be calm and make it through the whole protocol. Usually takes about 20 minutes once we get started. And then it becomes a daily thing as you can. The protocol that I have coming up here, I have a couple QR codes. So it's based on a research study that just focused on acupressure. It focused on two different protocols. It did find that one was more effective than the other. So I try to focus on the more effective one, the relaxation protocol, first with patients before I use the other one. Um, Ground rules for acupressure are a couple of things. Find a quiet place in a comfortable position. So I know a lot of you are at your computers today. This is recorded. If it's more comfortable to listen, put it on your TV later on or on your phone, somewhere where you can sit and have space to move and flex is going to be helpful. Some of the points are around the head, but some are also down by the feet. So you want to be able to get to your feet wherever you're positioned. Um, Pressure should be applied for 1 to 2 minutes per point. If you do read the research study, the QR codes on this slide, one is to the handout on my website that I give to patients, and the other is the original study. If you read through the original study, they do say to hold pressure for 3 minutes. I find in practice, holding one point for 3 minutes is a long time for people. So I try to tell patients 1 to 2 is fine per point, and then, work up to 3 minutes if you feel like that's more beneficial for you. Um, the points that you might feel they might feel sore, like a sore muscle or tender, and that's fine. When I'm palpating on my own patients, I'm looking for the point that tends to be a little bit more tender. So it's not a bad thing. And the pressure that you're using should be enough to elicit a little bit of that tender sensation with each point that you're doing acupressure. And as I said, treatments are done once every day, once a day. You're applying pressure to one point at a time. You're holding contact for the point for the entire 1 to 2 minutes, and then you're moving on to the next point. I find it's helpful to start from the top and work your way down. Some people like to start right to left, some left to right, whatever is more comfortable for you. I'm left-handed, so I tend to start on the left side. And we will get into the points in a moment. I think for my for my curating of acupressure point protocols as we go through the 6 weeks, I ask that in the chat maybe share some things that you're interested in treating with acupressure. And then anything that you notice as you go from point to point, feel free to put that in the chat. Okay, so there are 5 points. A couple are unilateral. One's unilateral. So one is right here, and then the rest of them are on both sides. So we will go from the top, back behind the neck. Part 7 is right on here. And then I can't show you the ones on my feet, but we'll talk through those as well. Okay. And I think for time, we can do maybe a minute per point, and let's see where that lands us with time to 2:30. All right, so me, yin tong, top. You have eyebrows. You're going to take one finger right in the center. And actually with this point, I like to take both. And you're finding that sometimes tender point right in the center of the eyebrows. I treat it a lot like meditation. So deep breath in, out. As you're holding these points, also focus on your feet or whatever part of your body is touching the ground. If you're on the ground, feeling your seat bones sink into the ground, you want this to take energy that might be moving upwards and sending it down to the ground. Pressure should be even through both fingers. I find sometimes with this point, if you have sinus pressure or headaches, it can be a little tender. If you need to take a break, go ahead. Just focus on the sensation of the point. And it always feels like 1 to 2 minutes is a really long time. And as your thoughts begin to wander, just try to bring them back to the sensation of your fingers pressing the point. And then the feeling of your feet on the ground or your seat bones in your seat. Yin Tong, this point we're pressing. It's a really good point for grounding energy and quieting the mind. Next point. So coming from here, I'm going to press this point. So on Myan, it's used for insomnia and sleep issues. If you come down behind your ear, there's like a little nook there. And you can feel a bone. It's your mastoid. You're going to roll your fingers over that bone to the back of it, towards the back, your neck, and then guide it down to where there's a little bit of tenderness. And I find with some patients, you can start on the left side. Treating this point, it's easy to treat this point with both fingers. If it makes you dizzy, lightheaded, one point at a time. And just gentle focus pressure. I'm starting on the left. You could start on the right. This point's also really good for neck pain. Neck pain that goes into the top of the shoulder and into the mid-scapular area. I'm going to switch to the right side. So again, you're going into the nook behind the ear. Should feel your jaw in the front and then the mastoid behind. You're rolling over the mastoid and you're going right into that little tender nook behind the ear. You can focus on your breath. If that helps guide your thoughts. Okay. Just one more minute for this one. This point is a extra point, but it falls on a few different channels. So sometimes when you're pressing on it, patients will feel a sensation down the neck, up into the back of the head.
I need to see her.
You can't see me? Nope. Can you see me now? Hold on. Okay, good. All right, next point, heart 7. So, outside of the wrist, right in here. Come to the bone. It's like a little knobby bone right there. Okay, good. And again, I'm pulling the left side. Oh, my neck just popped. This is going to be a really good series for me to do this once a week. All right, so there's a little tendon sometimes, and then the bone, and you're going right in that nook. That's helpful. Just like that. Sometimes it's tender, sometimes it's not. We sometimes use the point that's down a little more proximal down in here for hot flashes with another point. But this one is called Shen Men, and it's a calming point for the heart channel. It just helps bring everything down and ground the heart. I appreciate that in this protocol because a lot of times difficulty sleeping is coming from lots of thoughts. And they do have some patients where they like to do this protocol as part of their going to bed routine. So I'm going to do one more minute before we move over. And as I hold this here, I'm getting neck tension. So make sure as you're pressing, you're still finding a position that's comfortable for the rest of your body. Okay, let's switch. I'm going to go to the right side, and again, coming right down here, you can see a little knob going in front, right where the tendon is. You might find but it's more tender on the inside of the tendon. My rule of thumb is always if it's more tender right next to it, choose that point. Now I'm holding it up here, but I'm realizing some of you might be more comfortable if you bring it down across your body and press more like this. It's less neck, upper back stiffness. And then you can lean if you have any armrests on your chair where you're sitting. This channel goes up the inside of the arm. It actually starts in the armpit and then branches into the breasts on both sides. And then it ends right on your pinky finger. With the pressure for everybody that's just joining, so we're giving deep, consistent pressure with 1 or 2 fingers. We're not massaging it and rolling it around. We're not pressing and then not taking our fingers off. It's called pecking. We're just giving consistent, deep, even pressure.
Hey, Jackie, could you raise your hand a little bit? There was
Yes,
people in the chat who were asking.
absolutely. So heart, so for those that just joined, because we've got a moment, I started with yin tong in here, right in the center. Then we went back behind the ear on the other side of the mastoid. And then we just finished doing heart 7, which is right outside here on both sides. Okay. And then I'm going to move to spleen 6. So this one, if you're seated, you can bring your leg up. And I'm wondering, I think next time I'm going to try to have better pictures. So you're going to your inside of your ankle bone. Going inside your ankle bone. And it is, let's see if this is helpful. It's probably going to be backwards. Let's see. So spleen 6. We're going on the inside of your foot. So that's the ankle bone on the inside. And then you're going to go one hand. So you'll take your hand like this on the inside of your leg. And then you're pressing on the tender spot. Let me see if I can come down a little bit. You can see mine. Okay, ankle bone. Then I'm taking, it's usually like 3 fingers up. And then you're going right along where the bone is. It's a little bit of a glare, I apologize. You're going right where the bone is and you're pressing. So the shin bone's here. This is like fleshy tendon. And you're going 3 fingers up on the inside. I like to use my thumb with this point. It gives a little better steady pressure. And again, I'm starting with the left side. You can start with the right side. Now, this one, I think, of all of the points on women especially, might be the most tender. So please don't feel like you have to push very hard. You can push just until it feels a little bit tender. Sometimes there's a little bit of tingliness to it if you have neuropathy. That's plenty. This channel starts at the big toe and then comes up the inside of the arch. And sometimes when you're doing acupressure, you can get a little bit of a sensation down the foot. Completely normal. Do one more minute on this side. And this is one of those points where sometimes you're more comfortable in a chair. If you have a lot of hip pain, especially those taking medication that can cause joint pain, you might be more comfortable on your back in bed. Sometimes that's easier. Sometimes on the floor. Sometimes asking someone else to do it is helpful. Okay, I'm going to switch to the other side. So on the other side, let's see if you can see that. So inside ankle bone, let's see if that's better. So ankle bone. Then we're taking 3 fingers here. We're going on this side of it, pressing here. Spleen 6 is the point. It's called 3-leg yin. So it's a point where all 3 of the yin channels intersect each other. So we use it for all sorts of things with patients. If you have a lot of swelling, lymphedema, don't feel, like I said before with the tenderness, don't feel like you have to press so hard. You can very gently press the point. We don't want to press hard enough that we're inducing like a pit if it's pitting edema. Just one more minute on this side. So positioning feet, I'm holding, if you can't see me, I'm crossing my leg over. So my right leg on top of my left leg. And then I'm finding the point, holding the leg stable like this. But you could also find it seated on the ground or lying on your back this way as well too. Okay. The last point is liver 3. That point is all the way down on the bottom of your foot. Put my feet on. Okay, tilting this down if you all can see me. So this point, it's not super clear, is my point. My feet on here. Okay, so you are going between the big toe and the second toe. And there's a little V that it makes right here. And you're going right in the top of the nook of the V, if you can see. That one's another one that tends to be tender on patients. This is also one of those points that if you have a partner, a friend, spouse that can help press this for you, all the better. So I'm pressing it this way. I also have patients that press feet on the ground and then press down like this. The only thing with that is, especially if you're in active treatment, sometimes you can get dizzy when you're going down and then up. So I do have, sometimes you can get another chair, pull the chair here, and then put the foot up and then press that way. It's also another one that if you're on your back and you're pulling, you can do spleen 6 and then the foot as well. So as we do different protocols, I'm going to hold like this. As we do different protocols over this series, we can work on showing different examples of positioning. It's a bit like yoga. But the important thing is that you're not putting yourself in a position that you can't stay in comfortably or get out of comfortably. Hold this one for another minute. Okay, I'm going to switch sides to the last one. So here. So again, let's see if I can get here. So you're going, here we go. Here's the foot, going right between big toe, second toe, right in between that tarsal, where the two bones come together like a V. And then you're pressing there. You might find that your thumb is easier. I know I do. And I know we're almost to the end. So for those of you that joined during, please make sure to put in the chat anything you're interested in acupressure protocols for. Like what things are bothering you right now in your treatment or post-treatment. Because in my own office, I tend to I use acupressure as take-home homework to bolster what we're doing in the treatment room. I'm gonna hold this for one more minute.
Are there handouts?
Yes, so the QR code that's up there, I can move this one. So there's two. One is the handout as we're all coming back. One is the handout that I give patients that has this acupressure protocol we just did today. It also gives the instructions for how to do acupressure. And then the other QR code is the original research article that has this protocol. If you're a research person and want to do some reading.
Thank you.
Absolutely.
Hey, Jackie, can you share that slide deck and then I can post it with the video later?
100%. Yep.
Great.
Okay. All right. I look forward to seeing everybody next week, same time. And feel free to keep messaging. And yeah, absolutely. I love seeing this stuff come up. Great.
Was the foot one for the liver?
Liver 3, yes. It's for
Okay.
the liver. It's also for the blood.
Okay, great.
Jackie,
And-
could you quickly just review the 6 protocol points? Just visually? Okay.
Yes. Can you still see the slides? Hold on.
Can you reshare? I think
Oh.
they're not shared anymore.
Oh, okay. Hold on a second.
And I know you had a hard stop, so I can also share some answers to these questions later on if you have to. If you
Well,
have to get off.
do you save the messages?
Yeah, I'll be
Oh,
saving
perfect.
all of these, and then I'll send all of those over to you so I can get back to everyone. When
Okay.
available.
I think that's great because I'm seeing, let me see if I can. Yeah, I don't think it's letting me. Okay. How about now?
Yep, I can see it. Can everyone
Okay.
see?
Yeah.
Great.
Yep. And I'll work on pictures as well next time.
Okay. Let me
Mhm.
take a picture.
Yes. And if I can go through the chat, then I think before we start next week, we'll do a little bit of a Q&A, answer questions from before, and then go into it.
Okay, great.
Mhm.